The most common side effect people experience with statins are related to their muscles. There's something called rhabdomyolysis where you get muscle breakdown and you get these proteins that are thrown into the bloodstream that can potentially cause kidney disease or kidney failure or heart failure.
One of the things that would kind of throw me off was, world class, we're not going to name names here in terms of the provider or the hospital, but there was very conventional treatment where he didn't have a non-zero calcium score. And so he was recommended a basic medication, right? What is your thoughts on that? For somebody who's active, somebody who works out, somebody,
Yeah, so like he was talking about statins. Statins are pretty much first-line therapy for people who have elevated cholesterol. There's a lot of data suggesting that they likely will reduce heart attacks. But what a lot of people don't recognize is you can reduce your cholesterol pretty significantly through diet. And the other thing a lot of people don't recognize is there are real side effects to taking statins, even at low doses. There's a couple of articles out there that looked at side effects of statins, the most common being statin-associated muscle symptoms. And in someone who's active, this is a big deal. By far, the most common side effect people experience with statins are related to their muscles. And these can be things like muscle tears or joint pain or myopathy or something called rhabdomyolysis, where basically you get muscle breakdown and you get these proteins that are thrown into the bloodstream that can potentially cause kidney disease or kidney failure or heart failure. It is something that's kind of overlooked because it doesn't occur to the vast majority of patients on statins. But if you're an active individual, if you work out, you're much more likely to potentially see these issues. Another thing that people don't really recognize is, and this is quite controversial, statins basically block an enzyme that's crucially important in cholesterol production in the liver, right? HMG-CoA reductase, right? And so basically you just radically reduce cholesterol levels. But cholesterol is a really important hormone. It's important in bile acids, important in the lipid bilayer around your cell membranes, it's important in mitochondrial health. Everyone talks about ensuring that your mitochondria are functioning appropriately. Statins actually have been linked to oxidative damage in your mitochondria. You get oxidative damage in your mitochondria, you get decreased ATP production, you get fatigue. Since statins are very important in the myelin sheath around nerves, there have been some suggestions that's linked to several neurologic conditions. It is pretty controversial, the link between statins and dementia. Some studies have suggested there's no link. Other studies have suggested there is a link. But, in the medical literature, we go back and forth about a lot of things. If there are studies suggesting that there might be a link, I'd probably try to remove it. And there are definitely some studies that suggest that there are even links to neuropsychiatric issues like aggression, agitation, irritability, and so on.
Whoa, so there's a neurological decline. Like we see a lot of guys, entrepreneurs and businesses in their 40s, getting pec tears, right? And other types of strains, because overtraining is kind of a big deal.
The other thing that I've seen in terms of our clinic, where we basically look at the patient as a whole, and it involves supplements, diet, exercise, and hormonal optimization, statins are associated with androgen deprivation. Androgen decreases, right? And so they may be linked to low testosterone levels because cholesterol is a very important compound in steroid production. Getting on a statin might, in some part, be causing someone to have low testosterone levels, which is, something that has been noted, but really isn't publicized that often.